This lunch and learn is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health providers with any questions you may have regarding a medical condition. This series was produced in partnership with the Swedish Medical Center Foundation. Philanthropic investment from our community is what allows us to offer the innovative, patient-centered care available at the Center for Healthy Aging. To learn more, please visit us at swedishfoundation.org. Now I'd like to introduce Dr. Nancy Eisenberg. Dr. Eisenberg is the Medical Director of the Center for Healthy Aging at Swedish Neuroscience Institute and Providence Health and Services, and co-leads Project ECHO Dementia. She is a subspecialty trained behavioral neurologist and neuropsychiatrist with an expertise in clinical neurodegenerative disease, implementation science, and functional brain imaging. She has over 25 years of experience in medical care for persons with Alzheimer's disease and other related disorders. Dr. Eisenberg is also board certified in lifestyle medicine, and the Center for Healthy Aging is an evidence-based lifestyle medicine clinic as well. This year, the Center for Healthy Aging is launching an innovative shared medical appointments for people with cognitive concerns. Caregivers are invited to participate in the visit as well. Shared medical appointments are a medical visit, but in a virtual group setting, including caregivers. There will be 2 groups launched in February, and this program allows for continuous participant enrollment. Participants must have either seen Dr. Eisenberg or one of her Swedish neurology colleagues in the past year to participate. There are monthly appointments, and each medical appointment will focus on a specific way to improve well-being and healthy lifespan. We are also delighted to announce that the Swedish Neuroscience Institute has been invited by the Alzheimer's Association to enter into a collaboration with them called the Dementia Care Collaborative Project. This project has been funded by philanthropic donations to the Alzheimer's Association and will bring educational and care resources to our patients. Swedish was the only health system in Washington state that the Alzheimer's Association has chosen to partner with thus far. Today, we'll start with a presentation from Dr. Eisenberg, followed by approximately 30 minutes of Q&A, closing right before 1 p.m. And with that, Dr. Eisenberg.
Good afternoon, everyone. I'm really happy to be here to talk about this topic, which is near and dear to my heart and I imagine to all of yours. So today we're gonna talk about caring for your loved one who is living with dementia. So I want to begin with this to just recall that this person who loves her grandchildren and her music and her life is really asking, pleading, please, you see, I'm still me, and though I may forget, I hope you won't. And so we're going to talk about ways to really care for your beloved, and also how to do that, the pragmatics and also some of the psychological dimensions. So, you know, there's almost, well, there will very soon be 6 million Americans who are living with Alzheimer's disease. And the older you live, the greater your risk. That is true for each and every one of us. 2 out of 3 of the 40 million unpaid caregivers in the US are women, 17 million of whom care for persons who are living with dementia. And if you happen to be 45 and a woman, your chance is 1 in 5 of developing Alzheimer's disease over a lifespan, when compared to a man who has half that chance, or 1 in 10 over the lifespan. The prevalence of Alzheimer's, as you see here, as I said, increases with advancing age. However, there are significant disparities, not only by gender, but also African Americans are about twice as likely than non-Hispanic white Americans to have Alzheimer's or other dementias. The death rates in people of color have increased dramatically over the last years. And Hispanics are also about 1.5 times more likely than whites to have Alzheimer's disease. In these groups, typically the diagnosis is delayed and is provided in later stages. And 2 out of 3 older Americans with Alzheimer's disease or mixed dementia are women. This is true worldwide, as you see here as well. So what is caregiving? It's really a broad range of mostly unpaid help with multiple kinds of health-related activities provided by either a friend, a family member, a partner, a neighbor to a care recipient. And this care partnership in the context of dementia is really associated with ambiguous loss. And what I mean by that is that it's not always visible to somebody outside of the family, the types of loss that are experienced within that partnership. And it's often very challenging, and there's no training booklet that people can turn to guide them along the course of this progression with this degenerative disease where there is progression ineluctably. And so sometimes people feel that they're sort of, feeling in the dark and it's not well illuminated, or they can hit a wall, for example. So it can be very challenging. And yet, it can really give you a chance to give back to someone who has cared for you. It can be very purpose-driven, very meaningful. It can have new ways of connecting with a loved one. You can keep that person who's living with dementia aging in place for longer as you are assisting them along their challenging course. And you really are this link between the medical care system and that person who is living well as he or she or they can live with their cognitive challenges and their progressive dementia. So we really try to see this glass half full, or this light here in the clouds. So what are some basic rules to set out in the beginning of this talk of caregiving? So caregiving, as I don't need to tell you all, can last a very long time. And as Eleanor Brown said, self-care is not selfish. You cannot serve from an empty vessel. And we're going to be returning to this theme throughout the talk. She also said, which I like to quote, this is she right here, someone had the nerve to tell you you were too old to do it, but you dismissed the idea as completely ridiculous. So you also have to trust in yourself, and self-care is vital. Really pace yourself on the marathon and plan on getting help and building this intra-professional team, and also the village of a community team as well. So you want to create a care plan which includes this self-care. And I just put this up here, what does self-care look like? What are some warning flags when you may need extra care? What are some things that can nourish you, and so forth? So you want to start with preparing and gathering really important information, such as health, personal, financial, and legal. What are the healthcare wishes of the person who's living with dementia? What are the list of diagnoses, doctors, allergies, and medications? And then this link down below is something that we created through the Dementia Action Collaborative, which is a legal and financial planning toolkit for people with dementia. And it's a very helpful resource, and you'll have access to these slides and links, which encompasses estate planning, durable power of attorney, goals of care, safety issues, and so forth. So here you'll see, for example, what is meant by financial information, estate planning, retirement accounts, bank accounts, all the sort of access to information, password information, and so forth, automating bill payment, the health information, including medications, and automating that as much as possible. And then goals of care, personal information, advanced directives, POAs, insurance, and so forth. And it's a lot to pull together, certainly. So in the first stages of the disease and your role as a care partner or caregiver, it really is pretty minimal. There may be some reminders or some scaffolding, maybe help with more complex executive function tasks like automating bill payment, for example, and initiating these conversations about, may you live a long life, but were something to happen and this were to develop, how do you envision, what are your goals, and so forth. So these conversations are best initiated early around goals of care and advanced directives. In mild cognitive impairment, there can be reduced frustration tolerance or mood symptoms. So really kind of identifying and getting treatment for those, helping with appointments. And then, as the individual who's living with dementia continues to decline, more support and assistance is really needed, specifically driving, managing behaviors, which we'll talk about later in the talk. So providing assistance in these daily activities of daily living, and bringing on this team. So you are serving multiple roles. You're juggling multiple roles here, including the care provider, a coordinator, a medical and financial information resource, an advocate. You're providing emotional support. You may be parenting the parent. You are caring for the beloved with shifting roles and managing the loss and the change. It's a lot. And I want to really acknowledge the multiple roles that you are serving as a caregiver, care partner. Additionally, you may be practically managing the household, assisting with daily tasks, overseeing medications, supervising reminders or activities, and then bringing on this team of help, community-based help, service providers. What are some new challenging behaviors that are emerging, wandering, safety issues, and then overseeing help from others. So what do we need? We need this team here that you can juggle with. We really need intraprofessional, team-based care. Ask for help when you need it, when it's needed, and maintain these accurate records, keep track of appointments, engage with a team. In addition, you are this information resource, and you may be sandwiched where you're caring for your parent and your kids who are home, getting homes, receiving schooling at home because of COVID. So it is quite a lot to juggle and to navigate and to do your best lovingly. You also may be in the position as an advocate. There's a global movement really to support people who are living with dementia. And it's hard, and we'll get through it. We'll get through it. So really, again, it's important to determine those goals of care, talk with the healthcare providers, make the wishes of the person living with dementia known to everyone, and then advocate within the care facility. Excuse me. You're also asked to be this emotional support, this loving presence. Encourage the person who's living with dementia to keep active and engaged in a tender and gentle way. Provide the comfort and support. And at a community level, there's a lot of grassroots, wonderful efforts, communities such as dementia-friendly communities, where there's a specialized residential options for memory services. There's dementia aware and responsive legal and financial planning. And through the Dementia Action Collaborative and other efforts, Momentia Seattle, which I'll show you, we're really trying to build that out in the state of Washington and within your communities. So here are some wonderful tools and resources that can be very helpful, such as the Dementia Roadmap, which may be familiar to many of you, which was created when a number of stakeholders came together to address the needs of families and care partners, specifically in the state of Washington. The Alzheimer's Association also is a wonderful resource with a 24/7 hotline, and we have a unique collaboration with a dementia care coordinator at the Swedish health systems level as well. In addition, there are virtual activities for you and your family member through Dementia Seattle or Snowmentia. Here's a wonderful pre-COVID gathering, and this is now moved into the virtual space with horticulture walks, caregiver support groups, early onset groups, a lot of support through Dementia, which has a monthly calendar as well. Okay, so first and foremost, as we've said, taking care. You've got to take care of yourself. Dementia care can take a really heavy toll on your health, your physical, your mental. And if you're unwell, it's very hard to provide that care for your loved one. You may experience depressed mood or anxiety or reduced frustration tolerance. You may experience feelings of guilt. Am I doing this well enough? And, stay curious in the process. You may also experience moments of uplift, moments of surprise, joy, and laughter. It's very complex, this care, in this context of ambiguous loss. So here you see this wonderful pictures of these moments of tenderness and caregiving, and at the same time acknowledging and holding the opposites, that caregiver stress is inevitable. Stress can be physical, emotional, social, and especially in this pandemic with the physical isolation and the lack of services, the lack of respite, or the complexity of being isolated in a community. So these signs and symptoms that you may feel in your body or notice is that you feel more overwhelmed more easily. You're having trouble sleeping. There's weight changes, somatic symptoms, achy body, or just hypervigilance. This can all develop. So again, rule number 1, what is the most important caregiving rule is self-care. A healthy caregiver is able to provide better care. Caregiving takes stamina, strategy, and help. So there can be personal barriers that can be examined, which can prevent this optimal care, such as unrealistic expectations, such as new physical and mental health problems that can develop, or existing problems that progress. So here, just taking some time to connect with an animal in the home, very soothing. So how do we address personal stress? Well, we want to identify the sources of stress early and change what you can and accept what you cannot. And really, if this pandemic has really called us to do that as best we can. So what are some ways to deal with stress that have been shown to be helpful? Everybody is, we want to have a personalized plan for each individual, and each of these may not apply to everyone. However, over time, we have identified things that have been shown to be of benefit to large groups. So laughter or finding ways to have fun, mindfulness practices or mind-body practices, exercise, getting out, putting on some music and dancing, healthy eating to manage your health and well-being, and the Mediterranean diet, which we'll talk about briefly, getting enough sleep, a spiritual practice or outlet, and then receiving the help that you need, counseling or receiving the care with the team. So, people are familiar, I imagine, with our fight, flight, and freeze, or our autonomic nervous system, and getting overwhelmed. And there are different ways that we can become overwhelmed. And ideally, in order for us to be the best caregiver or care partner that we can be, we want to try to reside in this optimal state, which we can call the window of tolerance, where we can access reasoning and our emotions. We can integrate information, we can problem solve, we can be flexible, nimble, present, respond to the challenge at hand. Now, there are moments in life when that is no longer possible because we are too upregulated, we can't calm down. That's a hyperarousal state. Or we are shut down, overwhelmed, and we feel like we can't move. That's hypoarousal. When our autonomic nervous system says we got to stop. So here's another beautiful kind of Pacific Northwestern image, and in rainbow form. And yesterday it was raining all day, but the sun was there. And You know, there may have been a rainbow, but this is where the growth happens, and this is where we function best, and we can care for our beloved best when we're in this window of tolerance, when we're not emotionally withdrawn, when we're not feeling upregulated or overwhelmed. So we're going to talk about ways to stay focused. Excuse me. So the good news is that there's a lot of plasticity in our bodies and in our brains, of this kind of information system. And so we can train to cultivate human flourishing. And that's encouraging for us. There are skills and strategies that we can cultivate for our own self-care. This is just an example of a free Healthy Minds program that helps you cultivate awareness and connection and other components that have been shown to be beneficial to stay in that window of tolerance so that you can best care for your loved one. So, you know, and maintaining your own physical health. So talk to your doctor and your health professionals about your stress and your health problems. Talk to your friends, talk to your psychologist or your social worker. And then it's January 2021. This is the time of New Year's resolutions. You know, let's commit to maintaining a healthy lifestyle so we can be there for ourselves and for one another. But it's not enough to commit. We're going to have to recommit. We're going to have to start again and do it gently with kindness as we start again and again. And then recognize and treat depression or anxiety, and know and hold space for grief is not unusual in the face of the ambiguous loss of dementia. In fact, it is a component of that care partnership for many. So Brene Brown says, until we can receive with an open heart, we are never really giving with an open heart. When we attach judgment to receiving help, we knowingly or unknowingly attach judgment to giving help. And I imagine that some of us are hard on ourselves. Some of you may be hard on yourselves in receiving that help. So I advise you, receive the help, admit when you need it, and accept it. And we need the help. We need help often. We're humans, we're social beings. There are times in our lives when we need help, and caregiving to somebody who's living with dementia is a time along which the course of we will need help. So time off gives you some rest. It can help you reboot, get back into that window of tolerance, improve your coping skills and strategies, more nimble thinking. So respite care can really give you a break. You can relax and do something for yourself, activities not related forcibly to caregiving. So as I said, it really can take this village. And, you know, it's okay to say to yourself, it's okay to not be okay. I'm not okay. It's okay. There will be times when you will need a respite. You will need emergency respite, or some agencies, there's referrals from area agencies on aging or the Alzheimer's Association or the 211 number that you can call. There are many different forms. A family member who may come over so you can take a long walk or have some time to yourself. So really leveraging that reboot, refresh kind of respite. And Medicaid covers some forms of respite. Medicare covers respite through hospice. Respite care is often an out-of-pocket expense, but some departments of health provide services on a sliding scale. You may need to provide insurance coverage. And then just if you look through your local, the Washington does have actually some funding for some people for respite care through the area agencies on aging. Okay, so what are some self-care tips? Tips for relieving stress and taking care of yourself. You know, what can you do? Talk to somebody through either a Zoom, pick up the phone, ask for and receive the help, get on a support group call if that is something that would be helpful for you. Some people find this extremely helpful, and the Alzheimer's Association has wonderful resources there, as I've mentioned. You know, try to remain as socially and physically active and engaged as possible, of course, with the physical distancing required in the COVID pandemic. Adopt a healthy lifestyle, and really let your provider know that you're a caregiver, because that is part of your health care. And then to really cultivate these skills that can uplift and promote resilience and a healthy lifespan, such as awe, such as gratitude, such as mindfulness and compassion. So I want to talk a bit, this is, I know, a busy slide, but really compassion is when you see suffering, you notice it, and you want to alleviate the suffering. And that is, you know, when you see it outside or when you experience it inside of the self. So self-compassion is really just compassion directed inward. And it helps us to live longer and to be happier and to be more present and able to care for our beloved. So as His Holiness the Dalai Lama says, caring for others requires caring for oneself. There are loads of myths that I want to debunk here today. So number one, people have been taught or people have these beliefs that it is self-indulgent or it's weak. Like if we're kind to ourselves, we're not going to be able to show up and do what we need to do. And quite the contrary, and this is science that is, you know, in peer-reviewed publication, this is work of Kristen Neff and Chris Germer, self-compassion really increases accountability. It supports the capacity for healthy or positive habit change. And that this self-criticism frequently arises from a place of fear where we really are not very effective. We're not in the window of tolerance to be present and to offer care. Another myth is that it's selfish, quite the contrary. As we saw with the quote earlier, that inner compassion or self-compassion broadens our capacity to give and to be present and to serve and to care for our loved one who may be suffering at another time. So we give ourselves compassion not to feel better, but it's when we are feeling bad, when we're struggling with anxiety or feeling guilty, or we lost our temper and said something we regret. You know, when we feel bad, we offer kindness and compassion to ourselves. And it has 3 steps. One is to really have that kind voice. You know, and I pose the question to many of you, are we kinder towards others than towards ourselves? So to have that kind of self-kindness, to also understand that everyone is going to make mistakes or experiences hardships, and then to have a mindful present moment awareness in that moment. So compassion towards the self, which is a part of self-care. It's a really critical component of self-care from a psychological dimension. It helps to build motivation, confidence, true presence, and this healthy lifespan or well-being. Okay. So I mentioned these resources and I'm going to come through them quickly. There are other resources for you. So we have to also acknowledge that along the course of caring for someone living with dementia, we're likely to experience or receive some behavioral challenges. So the behavior may be judged to be inappropriate relative to the needs of the individual or the situation. What I would ask us to think about is that it's an unskillful expression of an unmet need in that moment. So that behavior is an unskillful expression because the skill is lacking of an unmet need. So dementia really destroys a part of the brain that helps us to really have that skillful, flexible, nimble thinking and behavior. And drugs that are used to control behavior symptoms often worsen dementia and increase fall risk and so forth. So the best first approach, of course we use pharmacology as well, but the best first approach is to use behavioral approaches to manage these behavioral symptoms. And there's a lot more information at that link. So what are some new rules for behavior? Well, when the old rule or the old approach is not implemented, then we have to develop a new approach. Again, in the context of the village, it takes a village. We need help. We need this intraprofessional team. So number one, and this is again with our, cultivating this space of the window of tolerance, we don't want to take those behaviors personally. It's extremely hard. I know that. And at the same time, it's not personal. It's the disease. It's not the beloved. So, and also if you're on the receiving end, it's not meant to be, it's not an attack of you. It's this unskillful expression. Number two, kind of getting below that to identify the feelings and the emotions. And then, starting again, letting go, take a walk, and then leveraging this village support. What about communication? I mean, communication is so difficult in the pandemic as well. And it can be really difficult with somebody living with dementia where communication breaks down. So when normal interactions don't work, new things to try might include slowing down and simplifying what you're saying in a gentle, reassuring, calm tone. Keeping the questions and the answers simple, sometimes an either or, do you want this or that? Being really as patient as one can be. Limiting distractions, turning off the radio or the television, and then bypassing language, tactile communication, a hug, a gentle, reassuring touch can really be a wonderful way to communicate as the disease is progressing. And then to kind of look at from an environmental perspective, simplifying the space, an environment that's safe, that cultivates ease. And what about a savoring space that every morning you might go to have your coffee or your tea with your loved one, looking outside, hearing the birds or seeing the cascades, snow-capped, and then kind of having that constancy of a pattern for the day, trying to keep things decluttered so that people can live as well. A strengths-based approach to live well with dementia is this kind of environmental approach as well. And then when you choose an activity, you want to choose something that's enjoyable, that maybe capitalize on physical strengths, for example, and kind of integrate that and bring joy to this practice, and consider the time of day. Maybe earlier is better because there might be sundowning. And then, of course, adjusting as the disease is progressing, and something that's positive that you can do together. You can set it up like, here's this puzzle, but let's do it together, and then you can finish it, or the person can finish it. And, encourage some creative self-expression. Embodied practices can be really great, and be flexible about the type of help, or try again, start again. So here's some tips on managing behavior. And then just in terms of self-care and staying healthy, we know that the MIND diet, the Mediterranean low salt diet, which is predominantly whole food plant predominant, is the best diet for dementia prevention and also management. And that applies not only to the individual who has the condition, but also to everybody in the room, to humans in general. And this is really helpful also for these chronic diseases such as hypertension and diabetes and so forth. So particularly in this pandemic, we've got to advocate for this risk reduction to improve health span. And then, you want to protect against dementia for yourself as best you can. So continue that cognitive engagement and stimulation. Sorry, one more thing. And then again, information is not sufficient to motivate most people to make sustainable lifestyle changes. So really working together for you to have healthy habits as well in a team-based type of care. So we at the Center for Healthy Aging are committed to providing this evidence-based, patient and family-centered healthcare through this intraprofessional and team-based prevention and collaborative care strategies. And I just want to, before, and as we said, 2021 is the Lifestyle Medicine Virtual Shared Medical Appointments. And I want to take a moment to acknowledge that really much of what we do and much of what we aspire to do at our Center for Healthy Aging relies on the philanthropic support. And in addition to the medical care we provide, many of the programs that we hope to offer, and such as what we're offering now, such as comprehensive, are value-added patient services, and we really can't bill these. So the philanthropy allows us to offer things like these caregiver support programs, or population health educational events, or other innovative programs. It allows us to do things like learning together to support one another, to improve the quality of life, health span, and the time that you have with your loved one. And we're not doing this to open doors, but really to develop this premier comprehensive destination for prevention, care, and treatment of people living with dementia, their families, and communities. So please visit the Swedish Foundation website to learn more. And I think I'll stop there, and thank you for your attention. And I'll stop sharing, and I'm happy to answer any questions that you may have.
It looks like we have a couple questions in the chat box.
Okay. Yeah, so the one question that I see, which is a great question by Teresa Lynch, is why are women twice as much at risk for Alzheimer's disease? And actually the second question from Raja Mawad is, with a higher percentage in females, is there a specific underlying reason? Similar type of question. So, and then there's a request to send out the deck, which will be on the website, I believe. Marnie can answer that. But that's a great question around women and risk. And there are a number of factors. I mean, women go through perimenopause where they have a lot of hormonal change, which is thought to be one of the reasons. Another is that depression and anxiety is higher or are higher in women. And these untreated can be neurotoxic to regions in the brain that are very important, that they can be pro-inflammatory. They also, as you saw, have a disproportionate role in caregiving. And this stress can also accelerate aging. Frequently when you're taking care of somebody else, you're not really adequately taking care of your own medical health or psychiatric or mental health. And so these are a number of factors which can may contribute to this discrepancy. There's also obesity rates tend to be higher in women, and diabetes. So there are a number of factors which can contribute, and this is being actively studied now by Lisa Mosconi and others. And there's actually, she just published a book last year in 2020 called The XX Brain, which dives deeper into this. But those are some of the factors that may contribute to that gender difference and the disproportionate prevalence seen in women. Okay, let me see here. So let's see. And then Marnie says, yes, we're going to post it. Okay. So Cindy Corson, do I have any advice for somebody when a parent, I'm just going to read this quickly. Hold on. When a parent has been diagnosed with Alzheimer's and their spouse and primary caregiver is not really absorbing the diagnosis or understanding how serious because other people can't really see the symptoms and says they're fine. They don't want to discuss anything about the future, any changes that might be needed. So this can be very, very challenging when a son or daughter perceives this, sees things differently than the husband or wife. And I would say that, like with any difficult conversation where you have a different perspective or on things, repeated conversations, sometimes coming back to the medical team together. We have a wonderful multidisciplinary team here, and we have a great social worker who's on the call who might want to, we could facilitate sort of a group conversation. It may be virtual around how to kind of bridge that understanding to get, of course, because both people really care deeply about the individual who may have the cognitive challenges. So how best to care for that person who's living with the cognitive challenges in a way that supports, needs, keeping goals in mind. Do we want to take a moment at this time to introduce Brenda? Would you like to say a couple words and introduce yourself? It just would be nice to have you say hello as a member of our Center for Healthy Aging team.
Hi, everyone. Can you hear me? Let me see if I can get my video back on. Let's see here. Oh, I don't think you can see me, so I'm trying. Can you hear me okay?
Yeah, we can hear you. That's
okay, great.
Yeah, thanks.
Great, fantastic. Yeah, one of the things that Dr. Eisenberg and I have talked about along with the center's RN, Alex, is starting to institute maybe these same page meetings. A lot of family members have contacted me indicating that some of maybe the adult children are not having a good understanding of the current diagnosis or the behaviors that the patient is experiencing. So one of the things we've talked about is maybe having a same page meeting where there's an opportunity for the family to get together and we can get an understanding of what the family knows and what they don't know. And then we can provide some education surrounding the medical diagnosis and psychosocial issues that are going on. And one of the things that that does is everybody then is on the same page, has the same information, and hopefully the goal would be to kind of come together in treatment planning or goal setting for the patient and the caregiver. And then the family can identify maybe ways that they can provide respite to that primary caregiver, which is usually the spouse. So that's kind of a way I think that we could be of benefit to the family, who's caring for the person with dementia, is that we can provide a broader understanding to the greater family and also, help with some care planning and respite.
Terrific. Thank you so much. And yeah, that's that same page idea, bridging gap and accessing programs and services, so important. So I have a private question about, I have a question about why Benadryl is not a good medication. And the answer is that it's anticholinergic. And anticholinergic medications can cause confusion and affect thinking. And long-term use is associated with an increased risk of dementia. So you want to avoid Tylenol, PM, or Benadryl. Certainly, if you have an allergic reaction, you can take it now and again, but we discourage use before bed. A lot of people will use that as a sleep aid, and that is not a good idea for long-term use for people at risk with dementia. Okay. There's a question about people to receive consultations who don't have access, and absolutely we are doing telemedicine appointments. I think that we've been doing those since the pandemic hit, gosh, almost a year ago. So yes, telemedicine or virtual visits are offered. Something nice about brilliant open communication. Thank you. Love the idea of a same page meeting. Indeed. Great.
Dr. Eisenberg, there is a question up at the top from Phyllis. Are there support groups that benefit the person with dementia?
Yes, there are absolutely support groups that benefit people living well with dementia, and there are a number of different types. There are sort of coffee shop gatherings, obviously virtual now, for different ages and for different stages. So there are even earlier young onset gatherings, and these are through the Alzheimer's Association. And if you have a different type of dementia, such as frontotemporal dementia or Lewy body dementia, there are also gatherings specific to your type of dementia as well. And through the Momentia link that I put in my talk, there's also lots of activities for people with dementia and their care partner. And some of those have a common activity and then breakout type activities as well. So there's a question about, is it normal to feel overwhelmed with my mom who's battling dementia for over 10 years? I feel guilty sometimes. And I think that's a really great and important question. And as you know, we saw stress and these kind of self-doubts are really inevitable as we're just in life in general, but certainly in caring for somebody who has cognitive challenges or dementia. And so, you know, acknowledging it, getting some help that you need, incorporating the self-care, bringing in the team, these are things that can help. And also normalizing it, that it's normal to have doubts or to feel, you know, at times guilty. That means to me that you care deeply and you want to really serve and to help and to care. Oh, let's see here. Let's see. Oh, there's a question about how is it best to approach the person who you're seeing the beginning of the struggle. So there's somebody who's stepped out, is 89, getting forgetful. You can see the frustration on the face. So you're concerned that he may need something, he's getting forgetful. I think the best way to start with that, I mean, there are a couple different ways. Number one, you could say, gosh, you could take it head on and say, I see that you're concerned about your memory. Let's get it checked out. Some people like to have it checked out with their primary care doctor first because they know that person best and there's a relationship established and there's trust over years of a relationship. Other people want to come to a center where there's a specialist, a cognitive neurologist, such as the Center for Healthy Aging, to have that evaluation or that conversation. And the way that I would frame it, specifically is, there may be things that we could do that would help you feel better, as there often are, which I mentioned around diet and lifestyle and sometimes medication or deprescribing or identifying and treating sleep apnea or getting hearing aids. I mean, there's a number of things that we've talked about in prior lunch and learns that, can really help people to optimize functioning, to promote brain health. So if you're noticing something with your stepdad, I would encourage you from the perspective of really helping him to get him evaluated sooner rather than later. I see a beautiful cat there, Robin. Yeah. And when people are there's a question about what about people who are in denial, and that can be really hard. And it may not be denial per se. It may be just lack of awareness because they don't notice it or feel it because their perspective doesn't give them that information, or the brain has changed in a way that doesn't allow them to understand their change or their challenge. And so, from my vantage, safety is primary. So if we feel that somebody's unsafe, we got to get them in, even if they can't see it or understand it, of course, and to try to do that in a way that's gentle and supportive, namely perhaps with their primary care provider with whom they have a relationship and trust. Just let's get it evaluated. Let's get you in for an annual checkup, or I'm concerned about something and let's check it out. I mean, if you're concerned, that tells me that there may be something that we could help with. And so I would act on that and really get the person. Maybe it's not the first time that you have the conversation. Maybe it's the second time, or maybe you enlist somebody else to have the conversation with that person who might hear it differently when it's from a different person, for example. So let's see here. My mom was diagnosed 2 years ago. I'm wondering what your recommendation. So she's been declining physically and she's withdrawn. And what is your recommendation for neurological follow-up, knowing that she's refusing most things? I mean, this is a very, very hard question when you, as somebody who loves your mother, wants to do as much as you can, and she doesn't want to receive that care. Again, I would try to work with the team, maybe bring her in for one evaluation just to see if there might be ways to help her, to ease her, to give her comfort and to give her ease. Would a provider be able to reach out to you for an interprofessional consultation? My experience is that there's a lack of awareness of resources and how to access for a person's care and planning. Yes, absolutely. There would be somebody able to reach out. That's what we said. We have a team, and there is Brenda, as our wonderful social worker, could reach out to link to resources, programs, and services. There's also the content that I shared through the Dementia Action Collaborative roadmap. There's also a new palliative care roadmap that's wonderful. And then the legal and financial planning toolkit. There are people who are here to help with that at our Center for Healthy Aging. There are also people within the community. And so we can help point you towards those resources, absolutely. And somebody asks how COVID has impacted dementia patients. And as many of you know, I mean, of those who have perished in the pandemic, it has disproportionately affected, I mean, upwards of 47% in America. People who have dementia are living in long-term care facilities and communities. And so it's really affected people with dementia in terms of death. It's also affected families in terms of this isolation, physical isolation. The activities that people may have participated in and the respite care that they may have received, or the sense of belonging in a community of engagement has had to pivot. And it has pivoted, and there are now more programs, as I said, in this virtual space. However, we're social beings and we're tactile beings, and the physical isolation has accelerated aging, and in some cases accelerated the progression of dementia for those in the context. It's also really been hard for caregiver support as well. As you might have been, you might have seen folks face to face weekly, and now it's virtual, and we all know about Zoom fatigue and these other challenges. So it's not, it's been a challenge for sure. I really echoed what Sandy said about Anderson about it's been very devastating for caregiver support, and that is true, which I think speaks to this, need for all of us, for you family caregivers, to kind of acknowledge that and to reach out. And maybe it's not ideal insofar as it's not in the face-to-face, to get the help and the support and to get the respite that you're needing. And there are resources in the community for the respite and the support.
Dr. Eisenberg, can I share real quick one of the tips and tricks that one of the families that I worked with quite many years ago, she said oftentimes family and friends were asking what they could do to help or support the caregiver. And oftentimes the caregiver said she felt overwhelmed, or she couldn't think at that exact moment, what exactly she needed. She just was feeling overwhelmed with taking care of her beloved. So one of the things she said at night when she wasn't able to sleep and she had a little bit of time to herself, that she would get index cards and she would write down things that she needed help with. Maybe it was grocery shopping once a week, or helping walk the dog, taking the trash cans out to the, to the curb each week. So she would write these on cards. And then when friends and family would come by and say, hey, what can we help you with? What can we do to support you? She would hand them the little stack of cards and say, tell me one thing in this, maybe take a card that you can help me with.
Mm-hmm.
And so she said later on, she said that it took some of the burden off of her with all of these daily tasks. It also provided that neighbor or family member a sense of helping out, and then they felt good about being able to help and support the caregiver and the patient with dementia. And also these tasks got done. So in a time when I think when we feel overwhelmed, when people come and want to help and we're trying to be stoic and say, no, we don't need help, we can do it ourselves, this is maybe a nice time to kind of have those ideas already written down and then let the person choose what they can and cannot help with. So that's just an idea that one of family members used that was effective for them.
Fantastic. Great.
Well, thank you, everyone. I think we should start to wrap up. I'm going to go ahead and share my screen. We will be posting these slides. We will be sending out the slides and also posting the recording in the next few days on the website. We'll send it out to anyone who's registered, but please feel free to reach out to SNI Neuroeducation at swedish.org. If you have follow-up questions, we'd be more than happy to get them answered for you. With that, I think we'll just say thank you, and we'll let you know if we have upcoming webinars.
Thank you.
Thank you.
Bye.